When the COVID pandemic hit, it made us stop all our programs. But also we would have done family support within the schools. We would have been on through primary schools and doing physical activity classes, nutrition. So all that had to cease, and what we had to do was rein it all back in and move everything online. We increased our platforms, as in our social media platforms. We updated our website. We started a new YouTube channel where we could get our physical activity classes out to as many people as we could possible. And then what we done was we tried to provide our resources through health and wellbeing packs so people could be entertained at home. So it was for families, it was for children in primary schools, it was for adults, it was for older people. The initial phone calls were, I think there were 760 odd phone calls made that were carried out for the first month to ensure that people were getting the services that they needed. I could roughly tell you there was probably over 1,000 people that we have provided support throughout this time. My hopes for the future is that we get people back onto programs. And I just can't wait to see the centres that we work on being busy again and people being about it, because it is very ghostly at times whenever you come in and you see that there's nobody there. So for me, it's just getting people back on. I do think people are more connected, and we're more connected to people out there who would never have been in through our services. We're really excited about introducing them into our programs whenever we get up and running again.
If you can imagine that our footfall in any normal year is anything up to 3,000 people, individual people, then what we really expect from a pandemic. So we kind of took a look at that and thought, right, okay, what is the best thing we can do? And the most important people that we needed to talk to were the people who were going to facilitate and deliver the services that we wanted to continue with. And each and every one of them says, I get really emotional. Each and every one of them says, whatever you need, we're here. One thing we are extremely proud of is how we adapted and continued and still continue going on a year of lockdown to deliver vital community-based services and support to all our members and individuals and families. We delivered our activities and programs, which are all about keeping people active and motivated. We continued to deliver physical health programs and activities. We started to sing, put it out in social media. We created videos, we created cartoons. We all told our own individual stories, honestly. Well, we predicted that we would see 2,300 individual people, and this pandemic has not stopped us. If anything, we have communicated, connected with and supported 3,335 people across the whole year. We have learned so much. We have so many learned experiences across COVID. Whilst there has been the difficulties, there has been really positive outcomes as well from COVID, and the biggest thing is connection. I believe that for the Pink Ladies Cancer Support Group, if we could work and still continue to deliver services whilst engaging with all our partner groups and deliver services to the people most in need throughout a world pandemic, then we can do anything, and the only way is up.
I think when COVID came along, it threw everything into complete chaos. Nobody was really sure, what was the right way to go about things. The team here had to adjust, change and adapt to try and meet the needs of the local community. We had to employ some people to do a listening ear, so we, and offer that bit of counselling and advice to local older people who were living at home, majority of those on their own. We came up with some ideas around isolation packs, physical activity packs, packs for carers, winter warm packs, all containing a range of items that would help, in terms of their physical, mental, social, emotional well-being. On the last count, we had delivered 1,350 of those over the course of the pandemic. At the height of it, there was in the region of 800 food parcels going out across the local area, which was a massive undertaking. But the volunteers really stepped up and played their part. When the restrictions were really tight, we came up with an initiative called Exercise on the Streets. And I think that we done in the region of 45 streets in Craigan, and there was about 1,300 people that came out to their gardens. Normally, we would work with around about 120 families, and during this COVID year, we've worked with in the region of 500 to help support them. The demand's been that high. So a key area of our work is working with people with long-term conditions. And once the pandemic came along, those people living with a long-term condition automatically had a shield, and we had to provide opportunities for those people who were shielding to be able to still exercise at home, talk to people in a social setting via things like Zooms and quizzes, and the feedback from that as well was that it was a lifeline for people. The pandemic has, in a weird way, brought people closer together. There's no doubt. I think the community spirit has been unbelievable. The response from everybody has been brilliant, and I would encourage people to keep that up. I'm looking forward to getting the centre open again. Normally the centre would be thriving with about 1,500 people a week coming through the doors for a range of programmes and services and activities. Just seeing people, chatting them, having a bit of crack. I'm really looking forward to be able to open the doors and welcome everybody back and see the smiles in their faces.